Hey, this is your host Temitayo on To Traffic Naija podcast. I truly enjoy putting this show together, but it's not all about me. I have incredible supporting network of listeners, of guests, friends, and family. This podcast is all about helping one another and creating content that will help improve oral health and our general well-being. Despite we trying our best to keep your teeth clean, our conversation today is on dental care for infants and children. Joining me is Dr. Lonnie Omobola, a consultant pediatric dentist. You're welcome, ma.
Thank you for the invitation.
Yes, thank you very much, ma. So how are you today, and how is practice during COVID-19 era?
Yeah, I'm fine, thank you. And practice is a little challenging, but we are coping. We are doing our best to do the best we can do, despite the situation of things.
Thank you. In a nutshell, I would want you to tell us the role of a pediatric dentist in the management of a dental patient.
Okay. Pediatric dentists are dentists dedicated to oral health of children from birth to adulthood. So from birth to adolescence, Basically, what we do is we want to ensure that the mouth and the structures within are kept as healthy as possible from birth till a child is 16 years of age. And we do this by giving oral health talks, by doing what is known as a dental home, by treating the children when they are brought to the clinic. And we do school visits, we do church visits when the need arises. So that's basically what we do.
Okay, thank you very much. Today we are discussing dental care for infants and children. What can a mother do to ensure good oral health while pregnant, and good oral health in an infant child that is yet to erupt any tooth?
Okay. Basically, we preach that, and we've found from various studies that the state of the mother's oral health is a great determinant of how the oral health status of her child will be. Meaning that if a mother has a good oral health, there's a high possibility that the child would also have a good oral health. So we always encourage mothers to be.
Okay. What about in the child? An infant that doesn't have teeth in the mouth yet, how would the mother make sure the child ensures good oral health in this child? Network.
Can you hear me?
Yes, I can now.
Okay. I guess yes. We always encourage them to clean, despite the fact that the child does not have any tooth in the mouth. We always encourage them to clean with a damp cloth after feeding the child, nursing the child. So as soon as a child is giving birth to and the mother needs to nurse, we always encourage them to clean with a clean cloth or a piece of gauze, dampened piece of gauze or clean cloth. Clean the gums, clean the mouth. Generally keep all the excess leftover milk out of the child's mouth. And we believe that if a mother has a good oral health practice, when it has become a routine for her, then it will be very easy for her to ensure that this is transferred to the child, because the mother is going to be the determinant of the state of the oral health of her child, mainly, basically.
Okay. So amongst mothers taking care of their babies, we know teething is a common topic of discussion. Please kindly put more light on this concerning the signs and symptoms of teething and what mothers can do to relieve their baby of any form of discomfort.
First of all, I'd like to start by saying teething is a normal thing. It's not a disease phase, because people tend to think teething is a disease, is a condition.
network again. So let's just wait for our guests.
This state is as. Can you hear me now?
Yes, I can.
Okay. This state, I don't want to say condition because it's a state, it's a phase, is associated with some symptoms and signs. And these symptoms and signs should not really cause any harm to the child. We see symptoms like a mild fever, very low-grade fever, slightly raised temperature. A child will become irritable. Since the child cannot really communicate, the child cannot really tell the mother what he or she is feeling. The child will drool, the child will produce a lot of saliva and drool saliva. The child may become restless. The child may have difficulty sleeping. The child will be extra clingy. The child might have swollen gums, itchy gums. That's why you see children constantly wanting to put things in their mouths. But when a child starts to experience high fever, stooling, diarrhea, let me put it that way, you see rashes on the child, the gum starts to bleed, or the child starts to convulse, these are not signs of teething. I really like to repeat this for the sake of emphasis. A child that has a high fever, that has diarrhea or stooling, or is stooling, that has rashes or bleeding gums, or is vomiting, or is convulsing, is not a child. Is not. These symptoms are not signs of teething. So such children should please be taken to the hospital. They should be taken to the hospital. So teething should not make a child stool, should not make a child vomit, should not make a child have rashes, should not make a child have a high fever, or make a child convulse. When we see such signs, such symptoms, we should please take such a child to the clinic to see a doctor. And we should also note that because these children like to put things in their mouths in the process of introducing many things, because it becomes quite itchy, the child would can carry something that is contaminated, something that is infected, something that has germs in his or her mouth, and that can cause an infection that will present with a high fever, may cause stooling, may cause vomiting. And that is why I said teething is a normal thing. So when a child presents with things that are not normal, then we should know that there's something else going on.
Thank you. Well noted. So let's talk about oral care for newly erupted teeth and then infants between ages 6 to 12 months.
Okay. I would like to state that as soon as a child erupts a tooth, as soon as you see that beautiful white crystal in your child's mouth, no
network. Don't do this again, Niger people. Network
erupts a tooth. As soon as a child erupts a tooth, we should note that the child is old enough to own a brush. Yes, brushing starts as soon as a tooth erupts. So we should get a soft bristled brush and smear a tiny weeny sized toothpaste. We should just put a little bit, just like a dot of paste on the brush, and brush for the child. And this brushing should be done, and the toothpaste please should contain fluoride, a fluoride containing toothpaste. The child should be brushed for last thing at night and first thing after breakfast. So brushing should start as soon as the tooth erupts. Then we should also note for children, we always, pediatric dentists, we always emphasize on the fact that the brushing from ages, as soon as the child erupts a tooth till a child is 6 years, the brushing should be done by the parents, because the child does not have the dexterity to do the brushing properly. So the brushing should be done by a parent. I didn't please note, I didn't say by the mother. It can be the father, it can be an auntie, it can be a caregiver. Yes, but the brushing should be done by an adult. And the brushing, so another thing we should notice that it's not just to brush with toothpaste and brush, but the brushing should be done properly, and we should not be in a hurry. We should spend at least 2 minutes brushing.
Thank you very much. As it encourage people to bring their children in for their first dental visit as early as possible. When and why should a mother or caregiver take his or her child for the first and subsequent dental visit?
Because most mothers are not pediatric dentists. They don't know the signs and symptoms of something going wrong. We always preach, we always beg, we plead with mothers to kindly bring their children as soon as they erupt their first tooth. We always say before the first birthday. We also want to have a familiarization thing with the child. We want the child to have a rapport with us. So when they are coming to us, the child is not going to be brought when there's a condition, maybe a painful condition. The child should have been brought when all is well. So when the child is coming, there's no reason to be anxious, or there's no reason for the mother or the child to be anxious about the visit. It becomes a routine thing. And we advise that they bring the child every 6 months. And we know a stitch in time saves 9. So if there's a disease process going on, we can pick it as early as possible and nip it in the bud before it becomes worse. So we always advise that the child is brought as soon as possible before the child is 1.
So I hope my listeners are listening. The methodology of how mothers feed their baby, for example, with the use of bottle feeding, I know is an important factor that is considered in identifying the possible cause of early cavities in children. Can you please throw more light on that?
Yes, thank you so much for that question. What the mother feeds the child with and what the child is fed on is very important. Would determine if this child will develop holes, tooth decay, or what is popularly known in the field of dentistry as caries. We should also note that even your breast milk can cause caries. So we advise that if you are going to nurse your child overnight, you should not put your breasts in the mouth of your child overnight, because what actually is responsible for this disease condition is a bacteria that most children and mothers have, and this bacteria need what is known as sugar, popularly known as sucrose, to survive. So it's like human beings, when you provide the food that the bacteria needs to survive, the bacteria would live well and multiply in the child's mouth and ultimately lead to the disease process. So we advise that if you are going to nurse your baby, if you are going to nurse in the middle of the night, you wake up, you carry your baby, you nurse, and you clean after nursing. If you are going to bottle feed your baby, we advise that by the time a child is about to celebrate the first birthday, you should have withdrawn the feeding bottle, because children who are older, who are already walking, would carry their bottle around and constantly have the sugary substance coat the teeth, and that will predispose to what is known as early childhood caries. That is caries in children less than 6 years. We don't want that. So, like I said, what you feed your child with, the utensils, the materials, whether it's the feeding bottle or a cup and spoon, matters. But more importantly, we are very, very particular about what is done after feeding and what you feed your child on. So all those sugar-containing snacks, drinks, and food items should be as much as possible discouraged.
Okay, thank you, Ma. Let's talk about the early warning signs of poor oral health in children.
Okay. Pain usually is the first sign. That's for children who can talk. That's for children who can tell you what they are feeling. But for children who can't, they will cry. You will notice that the gum is swollen. The child might start to bleed from the mouth. You might notice some ulcerations. The child might have a bad breath. Anything that doesn't seem right is a sign that something is going on, and such children should be brought to the dental clinic for proper examination.
Okay. Another thing is oral habits in children. How can this affect the child's oral health? And should parents see a dentist about this?
Yes, thank you so much for that question. A lot of children have different habits. We have habits like thumb sucking, finger sucking. It doesn't necessarily have to be the thumb. We have nail biting, tongue thrusting, sticking out the tongue, mouth breathing, a child that constantly leaves the mouth ajar. So many habits. Some will bite their lip, some will suck on their lip. All these habits ultimately would affect the oral health of your child. A child that leaves the mouth ajar is more susceptible to developing caries. The child is more susceptible to having what is known as calculus, hardened debris in the mouth around the teeth, and that can predispose to gum disease. A child that sucks the thumb can have what is known as malocclusion. So the arrangement of the teeth will be affected. So many conditions, so many habits that can really, really affect the oral health status of the child. So I would advise that mothers, as soon as you notice that your child has a habit, it's usually better to help curb the habits when it is caught early than when the habit is fully established. So I would advise that the mothers bring their children when they notice that there's a particular habit, so that we can help.
Okay. Thank you very much. Hello? So we just spoke about oral habits that is important for us to identify this early and see a dentist.
I'm here, I can hear you.
Okay. So there are some dental conditions that I think are quite important, and I think it's important for us to discuss it today as well, like neonatal and natal teeth. I know Yoruba, most of us call it enyoke or something. Then cleft lip and palate, tongue tie. I think it would be good for mothers to have a little bit of knowledge about this.
Okay. First of all, I would like to say that if a child has something that is outside of normal, we shouldn't assume that the child is evil, the child is abnormal, the child is a spirit or a demon, because we hear so many things. There are so many myths out there that children who are given birth to with a tooth in the mouth should be killed, should be thrown away, should be abandoned, should be feared. Such children are perfect. They are just a little different from normal. That doesn't make them abnormal. So if a child has a tooth in the mouth, is referred to at birth, is referred to as natal tooth. The child there's nothing wrong with the child. It's just that the tooth came out earlier than it should. And we should not, because of that, stigmatize such children or abandon such children. We hear so many things. The mothers are accused of so many things. It is not the fault of the mother. It is not the fault of the child. It is not the fault of the environment. It's just that the tooth decided to come out earlier than normal. And when a child has a tooth from birth to the first 30 days, 28 to 30 days, is referred to as neonatal tooth. That child is perfect. There's nothing wrong with the child. It's not the child's fault or the mother's fault. If a child is born with a cleft lip or palate, the child is perfect. There's nothing wrong with the child, apart from the fact that there's a part of the body of the child that is a little outside normal, and it can be treated. So such children, such mothers should not fear. There are so many centers available in Nigeria now. In the University College Hospital, we have what is known as the cleft team, dedicated to treating these children. Those abnormalities can be treated. So the public should please not stigmatize the family, because the psychosocial effect of these conditions is so marked that mothers don't want their children anymore. We've had so many cases of mothers wanting to strangle their children, mothers wanting to we've actually had some who actually abandoned their children. So please, such children are perfect. It's just that they have something a little different from what we are used to. and they can be treated. Yes, they can be treated. They can be treated.
Thank you very much. So we've come to the end of today's discussion. Thank you,
You're welcome.
Omobola, for supporting this show by joining us. By the way, she's my big sister and a pretty one for that matter.
Thank you so much. I'm grateful. Thank you.
Yeah, I hope you will join us again on
definitely.
Traffic Nigeria. Thank you so once much. Again.
All right. Thank you.
To my dear listeners, thank you for joining us again. I'm your host, Dr. Temitayo. Bye for now.